Hi, I'm Jess. I'm a mental health support worker and I'm an iFuse patient. I had my procedure done 6 months ago and it's the best decision I've ever made. My pain gradually came on after I had my daughter. For nearly 3 years I was struggling. It was just getting worse and worse to the point where I was bent over like an old woman. I was dragging my leg. I couldn't walk down steps. My morning journey down my steps was pretty much it. My child, unfortunately for her, had to do a lot of stuff for herself. The pain would it would stop me from just being able to pick her up from just where she was standing. Being able to get down on the floor and play with her just pushed me to realise that this isn't the life that she deserves. She deserved so much better. The doctor sent me to a specialist physio who then referred me on to have scans. That showed that I had degenerative discs, but then I was told that could take up to 3 years to actually see someone, let alone get any solution. So I met with a consultant who then referred me to Mr. Mohanty, and that's where my real journey began.
My name is Khitish Mohanty. I'm a consultant orthopedic and trauma surgeon based here at Cardiff. I've had patients from all over the UK to come and see me for this condition. And the usual story is that they've either had back operation or have been dismissed as mechanical low back pain where no active treatment has been kind of provided or offered to them. Some people come to me in wheelchairs because nobody has been able to diagnose their primary problem.
When Mr. Mohanty got me from the waiting area, I could see that he was analysing the way that I was sitting, because I couldn't sit like this. I always had to sit like this, take all the pressure off my left hand side. As soon as I went into his office, he moved things like no one else did, put pressure on areas that was not discussed before. Thankfully, the injection did give me relief. I was able to walk around and put weight on my leg without the feeling of it going to buckle. A little bit of insight from Mr. Mohanty as to what it could have been and that there's potential of fixing it. It brought me out of my darkest place.
Once the diagnosis is confirmed and we have gone through all the other conservative or non-operative methods of management, I usually counsel my patients to have a minimally invasive sacroiliac joint stabilization.
Coming out of anaesthetic, it was incredible. You can instantly feel a change. You feel solid. Because I've had a few surgeries and you come out of it, you're feeling groggy, you don't really understand what's going on, you don't feel any difference for a little while. But this was instant. I was able to get up on my feet with crutches, go to the toilet. It's very easy surgery in the sense of recovery, because there's a lot to it. You're on crutches, that makes things difficult, but you just feel so much better instantly. It gives you all the oomph you need to get through it. The best moment while regaining my strength for me was following my daughter up the stairs and her turning around and saying to me, "Mummy, you're so fast. What happened?" She thought I was a superhero and it was lush.
When you accurately diagnose them and carry out a rather simple procedure, and when I see them 6 weeks later, they have been the most happiest of the patients that I have come across.
So since having the surgery, I've reclaimed my life and started to give my daughter hers. She's now able to go on long walks with me. We've spent lots of time down the Jurassic Coast recently. Before surgery, I wasn't able to get down on the floor and play with my child. And it would break my heart, it really would. She'd bring all her toys up onto the sofa, which would help a lot, obviously. But now, I can get down there. I can even throw it up in the air. It's amazing what 3 bolts have done to my life. This surgery has been an absolute lifesaver. I don't think if anyone had any worries or doubts about getting something like this done in the future, I would definitely give them the 100% go ahead to do it. It's life-changing, it really is.